Welcome to the Live Fully with Kratom podcast. I'm ETHA co-founder Alexander, and with me today we have a special guest, Dr. Oko Budejo. Dr. O is a spinal surgeon and the inventor and patent holder of a device to help people strengthen their core muscles and avoid back surgery as much as possible. Let's get started. Good morning, Dr. Oko Budejo. How are you doing today?
Doing great. Thanks for having me.
Yeah, so appreciate reaching out and being able to connect with you. But yeah, I wanted to kind of get into your background and what led you to become a spinal surgeon.
Absolutely. So I'm an orthopedic spine surgeon. I've been in practice now for about 17 years. My interest in orthopedic surgery began probably in college. I knew I wanted to go to med school. I actually was already in med school by the time I enrolled in college because I was in a combined program. Then it was just a question of what field would I go into. And I wanted something that was hands-on because I
Mm.
like to fix and kind of be the end point. So I knew surgery was most likely the direction I wanted to go. Then the question was what within surgery. And I liked the idea of working with athletes and doing something that I felt was dynamic. So naturally, that moved me towards orthopedic surgery. So after undergrad and in med school, I did a few rotations in orthopedic surgery, and that solidified my interest in orthopedic surgery. And then I did a residency in orthopedic surgery. And within residency, you see the different fields of orthopedics, including sports, hand, tumor, spine,
Mm.
and spine just caught my interest. I like the complexity. I like the delicate nature of the surgery, the fact that you've got to be super locked in and really want it to be a spine surgeon. And I just found that that's what pulled me in the most. So I've done exclusively spine surgery now for 17 years, and it's been a wonderful journey so far.
Wow. Yeah, I mean, it's super impressive as far as, I mean, the little bit that I know about potential surgeries is that the intricacies of sometimes going in through like the abdomen and then having to go through all sorts of nerve bundles, really having to be very careful. And then just, yeah, I mean, I just know the complexity from my own experience of how functioning my back is, which, I mean, I'm a mechanical engineer as my training. And so I just appreciate how mechanics work in general. And the human body is so fascinating, how complex it can be, how flexible, but also rigid and strong. And yeah, that really comes from that central core that is absolutely amazing. And when it goes wrong, everything seems to go wrong from that starting point.
Absolutely.
Yeah, so what can you tell me maybe more about some of the most common causes of back pain that lead to surgery or potential surgeries?
So actually, most people with back pain don't need surgery.
Ah, okay.
Yeah, most people don't need surgery. So the most common causes of back pain are just normal degeneration, wear and tear as we get older. Some people experience that sooner rather than later. Some people are very active early on. Maybe in high school, they play sports or they do gymnastics, football. So there's a lot of stress to their spine, especially their lower backs, and they start to develop pain early on. Some people actually have structural issues, something called spondylolisthesis,
Hmm.
where the bottom vertebra has a problem with the facet, and that can be a cause of pain. So depending on exactly what the origin of your pain is, that's what determines how we treat it. For the most part, most people with back pain, they get physical therapy, strengthen their core, they do well. Some people have persisting pain, and then we investigate a little deeper. We get advanced imaging, we get MRIs, CT scan, and if there's something structural, if physical, then we get them into physical therapy. If that therapy alone does not resolve it, some people need pain management, so they'll get injections. If that resolves it, then they're pretty much done and they can move on with their lives. People who fail both physical therapy and pain management are the ones who end up getting surgery. And the most common surgery that we see in spine is from herniated discs. So the most
Hmm.
common procedure is called a microdiscectomy, where we take a disc off a nerve to resolve
Hmm.
pain. That's usually people who have shooting pain. And there
Okay.
are other things we see as well, but the most common thing would be a herniated disc and getting a microdiscectomy.
Got it. Okay. Yeah, I mean that resonates as far as I mean my story. I started noticing some back pain in high school. And so I played soccer very competitively, club level and through high school. And yeah, I want to say freshman year in high school, I really kind of noticed just like I kind of twisted something and then my back was just in a lot of pain, lower back muscles. And yeah, at the time it was kind of just recommended that I work on my posture, work on some physical therapy. And then I also went down the path of chiropractic care because I had some soccer coaches that kind of recommended that modality to kind of complement the core strength and kind of posture correction.
Right.
And so that worked pretty well for me for a number of years. But then, yes, as I think as you mentioned, as I got older, my back pain kind of flared up, and getting an MRI found that I have some just hereditary degeneration between my L5 S1 vertebrae. And so yeah, is there, I guess, with that, what kind of, I mean, I found some exercises in the last few years, specifically kettlebells for me have been a great addition. I think because it's really helped me strengthen my glute muscles. Because I mean, I also, I'm a, like I said, engineer background, so I'd spend a lot of time in front of computers and just working on projects. So getting like tight hip flexors, and so like learned how to do physical therapy to loosen those up. And I think the kettlebells help kind of balance that out with the glute strength.
Right.
But what other recommendations do you have or that you've seen work really well for core strength?
I think your ability to do the exercises depends on exactly the nature of the pain that you have and the intensity of the pain that you have. So the simplest routines are the ones that don't put too much flexion extension on your spine as you're working your core,
Mm,
things that are in line. So I would say doing planks and leg raises are probably the simplest exercises. And then you can advance exercises into doing elevated leg raises where you're working against gravity, using kettlebell and different routines with kettlebell, I think are wonderful. Sit-ups are great as long as you don't put too much stress on your neck as you sit up. TRX, using TRX for different routines is also a great way to strengthen your core. But I like things on the ground. I like things that involve movement. So that's why I like using an ab wheel because it involves movement. It's dynamic. But the movements with the ab wheel and the limitations of the ab wheel is what led me to creating a 360 CoreBoard, which is a device that you can use to strengthen your core, which I'm sure we'll get to a bit later.
yeah, yeah. I mean, it's a fantastic device. I know you were gracious enough to send me one. I've been using it for the last week and a half, and it's a really fascinating, fun device, and kind of has brings in a lot of that movement. I know for me, when I was getting into strength training, Um, I was always very interested in playing sports. So yeah, growing up playing soccer and all sorts of, competition wise. And I know core strengthening, kind of lifting heavy weights, doing just muscle training is important, but it was really hard for me to get into, I would say, the passion for it or really get into a like liking it, so to speak. And so that kind of kept me maybe not doing as much as I should have when I was kind of going through all that athletic training. But what I found was something like functional training. Like there's this online or video called P90X, which is more around athletic movement plus kind of body movement plus just it kind of kept things interesting for me. And that's what I love about the 360 core board is that it has this kind of playfulness to it, kind of openness that just allows me to do different movements and kind of keep that routine very dynamic and changing where that way I don't get bored of it. I can kind of make games out of it. So I love that aspect of what you created.
Thank you. Thank you.
But yeah, but how did you, I mean, how did you decide, you're a surgeon, super busy doing all this great work, but then how did you, you turned into entrepreneurship, inventing this product? What was that journey like? When did you decide to do it?
Absolutely. So I've always had a creative mind. I always look for problems and try to find solutions to them. And because I've had a strong interest in fitness and core specifically, doing my routines, just like you said, it can get a little boring. It can get a little routine. And using the ab wheel, there's some movements that I felt were missing. And I looked for devices that perhaps had those movements. I couldn't find anything. So I got creative. I went to Home Depot and
Hmm.
I started tinkering, putting things together. And gradually over time, I started to have a sense of what was in my head as to what I wanted to create. And once I had a firm sense of what it was, then I worked with design engineers, and we were able to come up with the full device. And I have two patents now for 360 core board. I came up with another device called 360 Dyna Plank, which is not on the market yet, but is there. So I'd say just being able to express myself creatively and having an idea become something tangible And if it's tangible and appreciated, then that's certainly something that's a great feeling to know that I've created something of value that people also appreciate. So I'm glad that you had such good words about using 360 CoreBoard. So.
Yeah, I mean, so maybe if we want to get into it a little bit more, I do have one here. So this is so we can get a little on camera.
Yep, that is it.
Yeah, and so I'll pull one of these up too.
So it's modular, it's dynamic, it gives you 360 movements, unlimited movement. The best thing about it, as you alluded to, you can be creative and you can have a lot of fun with it. So pretty much any movement you can imagine, you can do with it. And it's great. It's great.
Yeah, and so kind of to describe it for just listeners that can't see what I just showed on camera, it is the 360 core board has two handheld, kind of almost like push-up bars, I'll call them. But what's creative is that there's a set of three wheels on the bottom. There's also a uh, system that covers the wheels, so it can be kind of a static push-up bar aid. But now if you remove that platform, it exposes wheels. And so now I can grab onto these handles and essentially go into a push-up position or say a kneeled push-up position. And this is where I can basically push my arms out, kind of like what an ab wheel would do. But because I have now my two hands are independent, I can go out to the side, do like a really wide butterfly. I can kind of put one straight, one wide, get a lot of movement to kind of really get that core, all the small stabilizing muscles really engaged. And then those two handles also clip into a board. So that board can then kind of also be used in the hands and maybe a little more assisting kind of in some of the earlier, start to the workout. I mean, ab wheels are super intense for ab workouts. I mean, I remember the first time I tried it, I think I was sore for probably at least a week, if not two. And I was probably, a teenager, super athletic. And at that point, it just ripped my abs, but it was such a good strengthening exercise. So yeah, ab wheels are absolutely amazing. But in addition to that reason that board on that 360 core board, I can then now put my feet on that board and put my hands just on a normal position, maybe supported with like dumbbells. And that now allows me to move my legs behind, kind of do crunches and as I'm in that position. So yeah, it gives us a lot of really good flexibility that I really enjoy about it.
Awesome. Awesome. Yeah, that's a great way to look at it. Another movement that I suggest you try at some point is to get like a balance board.
Okay.
Have your so imagine yourself in a plank position with your elbows on a balance board, and then you have your toes on the core board. So as you're balancing yourself with your elbows and forearm on the balance board, now you're doing knee tucks as well with 360 core board, and
Uh,
you're really engaging everything. So that's
yeah.
more advanced movement, but that's another movement that I enjoy, and that's part of the creativity of using a 360 core board. Pretty much any movement you can think of where the board's engaged, or you can take off the board itself and use the hand pieces. There's so much you can do with it. So
Absolutely. Yeah, how do you recommend people get started with the core board? Like what are some of the starting exercises?
I would use it first as a regular ab row initially,
Mm.
and it depends on how active you've been with strengthening your core. So, but the first movement, use it like a regular ab wheel, just forward and back from your knees. With a good padding on your knees, and then once you're comfortable doing that, then you can start adding different movements. So usually, I do like an X movement where I'll extend one arm further than the other, and then come back, and then go back the other way, doing the same thing. And then once you're comfortable with that, then you can start doing rotational movements with the board, going to your
Mm.
right, maybe sweeping all the way down to your left and coming back the other way. And then once you get comfortable with that, then you can take off the board and use the hand pieces individually. And just like you described, you can do Y movements where from your knees, you kind of go forward into a Y. And then so your arms are going from in to out, and then you can also do out to in movements, doing the same thing.
Mm.
And then an advanced movement is actually having one of the static clips on one piece, so you're kind of holding yourself down, and then you have one that's free with the wheels moving, and then kind of doing a push up while you're rotating in and out.
Oh, okay.
That's another advanced move that you can do. So a lot of these movements are shown on the website, but yeah, as creative as you get stronger and more comfortable with it, you can get even more creative and just start doing different movements. And the sky's the limit, literally.
Yeah, yeah, it's absolutely amazing. Yeah, I love the videos you have online, kind of demonstrating a lot of those movements and abilities. And I also think there's the videos show that you can clip bands, so like
Yes.
elastic bands into it, into the handles or into the device, either to kind of looks like to assist. So I know some of that, if you have not worked on your core, done a lot of ab wheels, there's a nice way to add a band to make that a little more gentle, a little more kind of progressive training. And then also it can be looks like a full total workout, putting elastic bands on the handles, doing shoulder, arm workouts, doing pretty much a full at-home system, looks like.
Absolutely. And the website has all those accessory pieces. One accessory that's on the site that I'll caution using is the weight vest. It's a weight vest.
Mm,
So, because with the weight vest, obviously you're adding more central weight so that there's a little more stress to your core. But I would caution with going in and out with your arms because if you're too extended, potentially it could put too much stress on your shoulder.
okay.
So, just be cautious with that. I included that because I use it, but because I've used it for so long, I'm pretty controlled with it. But if you're going to use a weight vest, just be cautious with it. Maybe just do movements that where your arms aren't going out too far, so you don't put too much stress on your shoulder, because your
Okay.
shoulder is what stabilizes you when you're using 360 CoreBoard. So you have to be aware of where you are, so you don't cause injury inadvertently.
Okay. How much weight do you put in your weight vest when you do that?
Actually, the weight vest has a fixed
Oh, okay.
has a fixed weight. So the weight vest we currently sell are about 16 pounds,
Wow.
16,
Okay.
17 pounds. Yeah. So,
Okay.
yeah, it's a good size. But yeah, it's another great way just to add another element to your workout. Maybe you can use a weight vest when you're doing, as I described, the balance board. That way,
Yeah.
plank has a little more stretch to it, and then you're doing the knee tucks with 360 core board. So then you're really getting a good workout.
Excellent. So, in addition to being, say, cautious with, adding that weight vest in maybe too early, are there any exercises you'd recommend avoiding?
Not necessarily. It depends on your musculoskeletal health. So if you have healthy wrists, healthy shoulders, there's nothing that you're really too concerned about, then you can use it at will. If your shoulders have been an issue or you've had shoulder surgery, then you probably should not use it at all. Just because a lot of the movements involve extending, and that could put stress on the shoulders. So
Okay.
I think that's really the fundamental thing. It's the health of you. If you have healthy shoulders, then great, you can use it however you want to. If you've had shoulder issues, if they're minor, you're probably okay. If you've had major shoulder issues, then I would not use 360 core board.
Okay. And then I guess, are there any other exercises outside the core board to avoid, or have you ever seen, yeah, kind of recommendations on what not to do when you're trying to strengthen your core?
If you've had spine surgery in the past, I'd be cautious with things that involve bending the spine as you strengthen your core. So I'd be cautious with crunches. I'd be cautious with sit-ups.
Mhm.
If it's things that are in line, like planks, those are great. If it's leg raises where your back is stabilized, either elevated leg raises or leg raises on the floor, those are safe. But anything that involves kind of a crunching movement where you're folding up your back, I'd be cautious with based upon what you've done with your back surgically if you've had surgery.
Okay. Yeah, I mean, for me, it's fascinating how much physical therapy and just human or understanding of human dynamics has changed over the, I don't know, probably several decades now. But I mean, like, a crunch is typically what people would think of as the stereotypical core abdominal workout. And yet I hear over and over that got to be cautious with that. There's much better workouts that we know about. And so there's been a lot of advancements in how to properly care for our body in a healthy way.
Absolutely. And another point I want to make is the most common activity that's a source of injury to the disc that I've seen is doing squats or deadlifts, because those two activities cause a lot of compression of the disc, and most herniations occur either at L4-5 or L5S1. So if you're squatting, be very cautious with how much weight you have. If you have a history of disc issues, then I would avoid squats altogether and maybe just do lunges. Deadlifts, when the fulcrum is too far ahead of you, then that puts a lot of stress on your disc, and the risk of herniation becomes much higher. So I
Hmm.
actually against doing deadlifts with free weight where the bar is in front of you. If it's one of the inline devices where you're within the ring, and you're doing the deadlifts that way, that's probably safer. But if the weight's in front of you, then puts the moment of action of axis of rotation too far ahead, and that puts too much stress on the disc. So I would.
Got it. Yeah. Yeah, I mean, I tried some deadlifts a number of years ago, and I think yeah, it was definitely too much for my back. I noticed that my back was very sore afterwards, and I think that's why I switched to kettlebells because kettlebells has a much lower weight versus a deadlift, but there's more of a dynamic movement that has kind of maybe more slowly and progressively allowed my back to strengthen and heal over the years rather than a deadlift trying to do too much, like too much weight at just at a short amount of time.
Especially with the kettlebell, the moment of rotation is closer to you, right? The weight,
Yes.
yeah. So that puts less stress on the back. So
Yeah,
just
absolutely.
be aware of where the weight is relative to your center, and
Mm.
that protects you. The closer it is to your center, then the more protective it is of your spine as you work out.
Excellent. Okay, great. Yeah, so I guess maybe kind of back to you kind of inventing the 360 core board. Is there anything surprising about going into that entrepreneurship path that you kind of uncovered?
Yeah, yeah. I would say the journey from having concept to having device is interesting because along the way, there are questions that come up that you hadn't really thought of. So, once I had worked with my design engineers and they sent me a couple of iterations and I finally found one that I liked and we had the final product, then the question is, how do we get it to market? And then you're talking to different manufacturers and you're seeing what your options are. And some manufacturers have a minimum number that you have to produce. So that's something you never anticipate. You just think I have idea, I'll bring it to life, and it's gonna sell out, and life will be wonderful. But it gets a little more complicated. And, I'm a scientist, right? I'm a surgeon, so I'm learning the business world as we go along. So I had to make decisions regarding the quantity of items to produce, and then what medium am I selling it on? What kind of team am I using to sell it? How much am I willing to commit to marketing, to trying to get the product out? So there's all these questions that I had never dealt with before that now become like a real issue, and I have to make decisions and hope that it's the right decision based on the outcome of sales once the product is on the market.
Yeah, absolutely. I know that was some of the learning I went through when I was doing entrepreneurship and kind of internal entrepreneurship, kind of lean innovation at HP. This idea that not only do you have to create an amazing product, but now I have to go in and learn how to create an amazing business plan or a business model. Because it's not just you can have a great product, but if you don't have the right awareness, if you don't have the right distribution, if you don't have the right price so that consumers can actually get it and use it, then your product just kind of unfortunately no one knows about it. So yeah, that was a big learning for me, that business model approach after creating the great product, right? So it's always learning, always getting more out there.
Absolutely. And for me as a surgeon, yeah, my practice is my priority, right?
Yes,
So finding the time, like how much time do I then dedicate towards 360 core board? Because just in terms of dollars and cents, the bang for buck for me, being a busy surgeon is much greater than it
sure.
is with individual sales of 360 core board, right? So I have to like decide how to allocate my time and what's smart and what's efficient. So it's all these decisions that you don't anticipate that become real once you have a product. But the gratification of creating and having your product appreciated is still, it makes the effort worth it because it's very gratifying. Like the gratification I get from doing surgery and having someone feel great afterwards, extremely satisfying. So that's kind of where the focus is. So it makes whatever sacrifices and time commitments worth it because the gratification is always the end goal from having something that has made a difference in someone's life.
Yeah, I mean that's absolutely amazing that you have that much passion and compassion for others to help and really see that. And is that, I guess, the most rewarding part of your job is helping people?
Absolutely. I mean, you go into medicine because you want to help people, and um, it's important to go into a field that you love. That way, if you're a passionate person, then your passion matches what you do. And there's nothing better for me than having someone come in, seeing them in distress. They have pain. I can locate where the problem is. I educate them. I spend a lot of time educating my patients so they know exactly what the problem is, what I'm attacking, what to expect, and to have them go from being in pain, very limited, to being way more functional, pain free, or pain minimized after my intervention. It's amazing. It's amazing because don't forget, you're growing up as a kid. You have an interest in being a surgeon, but
Mm.
you have no idea what kind of surgeon you're going to be, right? You just know I like the idea of surgery. I'd like to make people better, and you hope that you'll be able to reach that end goal. And then I literally would stare at my hands and say, man, I hope my hands will be able to live up to what I desire in life, which is to use these hands to get people better. And you go through training, and then that's a process. And as you go through the process, you start seeing your skills develop, and then you start getting more confident and more confident. And then once you're in practice, then you have to make decisions regarding matching the right procedure to the patient's problem and hoping to get the proper outcome. And as those things start happening, then that gratification just grows and grows, and it becomes extremely rewarding.
Yeah. I mean, do you have a particular story of a patient or person you've helped that really sticks with you?
Absolutely. This is about maybe 5 years ago. I had a gentleman who came in pretty much in a stretcher, and I taking care of his wife, and he was in a lot of distress and a lot of pain, just barely functional, and got an MRI of his neck, and he had severe compression in his cervical spine, what we call cervical myelopathy. Um, and once I made the diagnosis, I looked at the treatment he already had, and there was no question that he needed surgery. He was not functional. So I did a posterior cervical decompression. So I decompressed the back of his neck, took out multiple bones, and I did a fusion to stabilize it. So envision taking out like five lamina from the back of someone's neck, and then placing 5, 6 screws on each side, and then placing rods and putting that all together, and just seeing how then they do after that. And probably within 2, 3 months, I made a video of him in my office dancing because that's how much better he was, and how happy he was. And nothing beats that gratification, because what you do, the workforce to get people, sorry, to get people better, it's just a beautiful thing.
Yeah.
Sorry.
Yeah, absolutely. No, that's very beautiful and touching that you're the amount of time and dedication, passion, what you've learned to be able to do that for people. And then like you said, I mean it's that yeah, I can't imagine that practice of going through how to choose the right surgery because you're taking such a risk and like putting your skills out there and then to see it come that full circle and heal is just yeah, it's got to be super gratifying.
Yeah, I mean, it touches you. It really does.
Okay, so if I mean, I've been fortunate enough to be able to use Kratom to reduce my pain, and then that allows me to exercise, keep my core nice and strong. So I've really, not had I have not needed surgery. I've kind of kept my pain manageable. I've used Kratom even less on a daily basis. Now I use it every few times a week, and I'm able to do all the activities I love, and the pain does not interfere with my life. However, how does someone know when they actually need surgery and should come seek your professional guidance?
Absolutely. So in spine surgery, most orthopedic spine surgeons classify themselves as either being a deformity surgeon or a surgeon that does more degenerative problems. So deformity is when you have scoliosis and you've got curves of different sizes, and there are different implications of the curve, and when you need surgery, and certain threshold based on number of the curve and your age. When it comes to degenerative cases, it becomes a little more nuanced, because we're relying a lot more on what our patients are subjectively telling us regarding what they feel, because what they feel is often the trigger as to what we do. So some cases are a bit more emergent. So if you have bowel and bladder symptoms, then and there's something anatomically correlating to those symptoms, then that absolutely has to be treated surgically. If you're having a weakness or advanced changes in function, your ability to walk or be functional, then that's something that absolutely requires surgery. But for the most part, a lot of what we deal with are issues with pain,
Mhm.
patients having pain. And sometimes you see anatomical changes that may look extreme. You may have big herniations. You could have instability, what we call anterolisthesis, at different levels. And some patients are not in a lot of pain, whereas other people have changes that are a little more subtle, and they have a lot of pain. So we just have to kind of figure out, try to marry the pathology to the subjective assessment of a patient's pain to determine what needs to be done surgically. So we always have patients go through conservative care first, meaning you've had physical therapy, you've had some pain management in terms of having injections, and then when it becomes surgical, then we use the conversation with our patients and their pain, marry it to what we're seeing with imaging, and then come up with the proper procedure. So the most common procedures that I do are a procedure called rhizotomy, where I go in with an endoscope and I work around the facet joints. And that's for patients who have primarily axial back pain, pain that's just in the back without radiation. That
Mm.
procedure can take about half an hour. Usually it's done outpatient, and most patients recover within a week to 10 days. If you have a disc issue where there's a disc compressing a nerve, then and you've gone through the conservative treatment and you need something surgically because of your pain, radiating pain, then oftentimes it's a microdiscectomy where either I go in with an endoscope based on position and I remove the disc, or I use tubes and a microscope and I remove the disc that way, and that decompresses the nerve and resolves the symptoms. It can get bigger if you have a bigger herniation or if you have instability in your lower back, that we may have to take out the entire disc, take out bones sometimes, and do a bigger fusion. And
Mm.
we can approach the spine either from the front, from the side, or from the back, depending on what level. And that determines the exact procedure, then determines what the recovery is. And then with the cervical spine, if you have herniations there, then most commonly we do procedures from the front of the neck where we take out the entire disc and we do either a fusion, an ACDF, or we do a disc replacement.
Mm.
So the pathology and the symptoms married together determine what we do surgically.
Got it. Yeah, that makes sense.
Yeah,
Yeah, and I know it's very difficult from the doctor's standpoint evaluating pain because there's not really a good objective scale that you can just test and get that feedback. You're really reliant on that interpretation of the patient and how they perceive the pain, what level it is. And so I know it's a very difficult process from your standpoint.
absolutely. Very nuanced. We're really relying on our patients and their communication of what they're feeling. And then that's what we use to determine what we do. But the most important thing for a surgeon is to educate our patients. So I do a lot of education in terms of having bone models and going through the MRI or CT scan in detail so they know exactly what I'm trying to accomplish with surgery. And also educating them about expectations, because not every procedure uh, will necessarily lead to the outcome that you want. There's no surgery that's 100%. There's a risk of complication. There's a risk of only having partial relief of symptoms. So it's critical that we are very clear with our communication. So expectations are set. That way, there's no disappointment at the end result once we're done.
Yes. Yeah, and since I follow Kratom research very closely, there's a doctor out of University of Florida, Dr. Christopher McCurdy, who is a doctor of pharmacology. So he does a lot of drug development. And I'm hopeful that one of his discoveries, kind of from years ago, that was this fluorinated compound that interacts with the sigma 1 receptor. They actually took this fluorinated compound and matched it with MRIs, and it was a really good indicator of actually showing and visualizing the cause of pain. And so they had some examples of a knee surgery removing scar tissue. The patient was still reporting pain. They fluorinated, they put this compound in, did an MRI, and saw, where the pain was radiating from. Did a second operation because, it's very hard to see the nuances of it without this kind of indicator. And after that second operation, the patient was pain free. So I'm really hopeful that, there's some advancements that'll help you be even more effective because I know what you're doing now is such a, like, as you put it, in art and just that complicated to say the least. So very appreciative of what you're doing on that side.
Absolutely. Absolutely.
And so if, assuming that I need back surgery, what would you recommend then, or kind of like the next steps? Like what would I go through?
So the most important thing if you're having back surgery, as I stated earlier, is to be very clear about what your pathology is. Have the surgeon show you and educate you as to exactly what the problem is, exactly what he or she is trying to accomplish, and what the potential risks are, what the potential complications are, and alternatives. So that's really the most important thing is education and understanding what's going to be accomplished and what to expect afterwards. So in terms of how you recover, it depends on the size of the procedure. So if we do something smaller, like an endoscopic procedure, recovery is very quick and it's usually just done outpatient. If it's a micro procedure where we can just work through a tube and just do a small decompression and takes us 45 minutes to an hour, you can pretty much go home the same day. If it's a bigger procedure where we're doing multiple levels or an open procedure, then expect to be in the hospital inpatient for 2, potentially 4 days. So the size of the procedure determines how long you're in the hospital and how long the recovery is.
Okay.
So it's just about clarity in terms of your pathology, what the procedure is, and what to expect with recovery.
Okay. And do you have any recommendations or guidelines then? Because as you know, this topic of the podcast is how to avoid surgery with core strength using your great 360 core board. So what about after some of those surgeries? Do you then recommend going into some of those strengthening exercises as well, or what does that look like?
Absolutely. Actually, a way to avoid surgery is by having good core strength, because core strength stabilizes your spine. And if you have minor spine pathology or you're just developing back pain, but you're functional, then get active, get physical therapy, strengthen your core, try to maximize your movement, and then you can potentially avoid further breakdown of your spine if your core is stronger or less symptomatic breakdown of your spine, and avoid surgery altogether. If you end up having surgery, then most patients, well, pretty much all patients need physical therapy. So I typically have my patients start physical therapy somewhere between 4 and 6 weeks post-op and expect to be in therapy for at least a month to 6 weeks. And the focus is movement and core strength, movement, core strength. And as your core gets stronger and you're moving better, then we focus on flexibility. So our goal is to get you back to your desired life when you were functional. So barring the fact that you've been non-functional for a significant amount of time, our goal is to get you better and get you moving more. A lot of patients tend to have a fatalist thought regarding surgery, meaning if they have surgery, then they think that's it, it's over. No, it's actually the opposite. Like the trigger for surgery is you not being functional to the degree that you desire, and the surgeon having a plan to get you to being more functional and having a better quality of life. So surgery is actually the solution when properly indicated, as opposed to being a problematic thing.
Yeah, absolutely. And I think that's kind of what you mentioned earlier with kind of really focusing on planks or kind of static core strength first, and then
Yes,
working into the flexibility, that playfulness. And that's kind of, as we touched on earlier with the 360 core board, that it really allows for that movement and kind of expression and keeping things interesting.
absolutely. And as you age, if you're able to maintain movement, then you're doing a great job, because our picture of aging is becoming stiffer, becoming less mobile, and just sedentary, just not really having dynamism, right? So if you incorporate activities that are dynamic, that involve a lot of movement, and you're able to just maintain that, then you're aging gracefully, which I'm very passionate about, graceful aging.
Yeah, yeah. And I imagine that you really have a great demeanor with your patients, just kind of providing that hope and energy for them because it's that mindset of being able to keep moving, keep flexible is seems to be a core thing that you're sharing a lot with that. So I appreciate you kind of being able to do that with everybody.
Absolutely.
Excellent. Is there anything else that you wanted to mention? So I know if people want to strengthen their core, avoid surgery as much as possible, would really appreciate if our listeners visit 360coreboard.com. And I believe you have a discount for our listeners.
I do. So our discount code is 360 core 20, 360 core 20. And this gives you a discount for every single product that we have on the website. And 360 core board is dynamic, it's fun, you can be creative with it. So I urge everyone out there to get one and have fun with it. And the website has the different routines that you can use, and you can become creative. And if you come up with something unique, send it to me. I'll add it to the website. I'll put it on social media
Oh, I
because
love.
yeah, we're always learning of new things, to use it with. And I'm creative, but I'm sure a lot of people out there are even more creative and they come up with things that I haven't thought of. So I'd love to see what people come up with and start using a 360 core board.
Yeah, I would love that as well because I know when I'm like in the middle of doing those workouts, it's like, okay, what do I do next? And so I'd love to have maybe just like a little picture or an image of like, oh, I can do that exercise and kind of get into it. So
Absolutely.
yeah, I would love for people to share and yeah, I'll see what I can do as I just got into the core board probably what a week and a half ago, and so love it so far. My abs are quite sore from yesterday when I tried to do workout, so I kind of took a little bit of a push-up break and just use that modularity of the system is absolutely fantastic. So I used it for some nice push-ups yesterday. Still getting some core static strength because I just didn't have that ability to do the motion yesterday. But yeah, I'll keep you updated on how that goes.
I can't wait to hear. Whenever I hear someone saying that their core is sore from using CoreBoard, that's music to my ears. That means you've done work. So I, I,
Excellent.
I love hearing that. Yes.
Great. Yeah, so thank you everyone for tuning in and getting more insight into back surgery and importantly, how to avoid it with keeping your core as strong as possible. If you found value in today's episode, we'd really appreciate it if you stopped by ethannaturals.com for all of your Kratom needs, as well as then stopping by our guest speaker's website, 360coreboard.com. If you have any questions or any future episodes that you would like us to feature, please leave us a comment below in the Q&A section, or you can reach to us directly at our email, podcast@ethannaturals.com. Thank you for tuning in. I'm Alexander, and with me is our guest speaker, Dr. Oko Badejo. Thank you, sir.
Thank you.